Okay, we're back. Okay, let me try to answer some of these questions which are unanswered from the previous part. So there were some questions about appetite stimulants and all that. Um, and Dr. Subramanian mentioned a few tips, just a few more things that I do for my patients. So I kind of try a few supplements like thiamine, zinc, or probably even fish oil. So I do a thiamine test, a blood test for thiamine, also for zinc. And if they're deficient, I kind of prescribe these supplements to my patients to try to increase their appetite. Also, I try to figure out whether patients have some sort of undiagnosed depression. Since depression is very common in Parkinson's patients, can affect their appetite. And sometimes, even if they're not depressed, I prescribe an antidepressant called mirtazapine, which can actually increase their appetite. And in fact, one of the more common side effects of mirtazapine when it's prescribed for, not specifically to non-Parkinson's patients, is weight gain, because patients, gain a lot of weight from it. So it is a trick that I do for patients of mine that are losing weight and are, despite the fact that they're trying their very best, to eat as much as they can. Okay, my husband was diagnosed with Parkinsonism. He usually complains of pain in his gluteus muscles and legs. He's on levodopa, carbidopa, rasagiline, pregabalin, and baclofen. How can we help alleviate the pain? Okay, so what usually patients with Parkinson's may have some pain, usually in the proximal parts of their thighs, or probably in the hips, or probably in the shoulders. It's more of a muscular pain. It's not arthritic pain. So if patients are taking optimal doses of their Parkinson's medicines and they're still in pain, I kind of have to look for other causes of pain, especially when it's concentrated in the back or in the legs or in the hips. So look for signs of arthritis, do x-rays, do MRIs or CAT scans. And then sometimes I even do an EMG, which is a nerve study, to see whether any nerve roots are being compressed or any focal, there's any focal nerve pathology that might be contributing to their pain. Doctor, I appreciate so much your attending my questions. We're about to do the skin test next Friday, and at that kind of time, I'm nervous. I don't know whether to want to be diagnosed with Parkinson or not. I'm not one who wants to be taking all kinds of pills. I guess I just need to let go, but it is hard. Any suggestions about? Yeah. So in the early stages of Parkinson's, as Dr. Subramanian had mentioned, one doesn't really need to be treated. And most of the time, many patients do quite well with just the sufficient amount of exercising, lifestyle change, getting enough sleep, taking care of the non-motor issues like depression or anxiety, loneliness, and so on and so forth. So just helping confirm that the diagnosis is really what it is. In other words, if you truly have early Parkinson's, it doesn't mean that we will prescribe you a medication. And in fact, the medicines that we prescribe for Parkinson's do not as they arise, and so just having the diagnosis or the right diagnosis will probably put you on the right track and guide your doctor and yourself in terms of what are the non-pharmacologic and potentially in the future pharmacologic therapies that can benefit you long term. Okay. And so let's see now. Any other questions? Okay, if not, I am going to share my screen now and show you a few slides from questions that were submitted before the webinar. Okay, can you see my slide?
Yes, we can see your slides.
Okay, wonderful. Okay, so one of the questions was, how effective can deep brain stimulation be for Parkinson's? And the answer is very effective, as long as you are the right candidate. So there's this misconception that deep brain stimulation is only effective for tremors, when in fact, if you don't have tremors, that it may not be effective. So that's a fallacy. That's a misconception among many patients and even clinicians. So Deep brain stimulation not only alleviates tremors, but also alleviates slowness of movements and rigidity and so on and so forth. And in fact, there's been studies also that deep brain stimulation alleviates many of these non-motor symptoms that occur in the off state. So, for instance, many of my patients feel very anxious, they feel down, they feel fuzzy-minded, they feel very uneasy when their medicine has worn off. So these are non-motor symptoms. And so if you keep the patient on with deep brain stimulation, and that's exactly what it does, it just makes you fluidly on 24/7 without the ups and downs that we see in more advanced Parkinson's patients. So not only does it alleviate the motor symptoms, but also the non-motor symptoms that many Parkinson's patients experience. So it is not a treatment of last resort. So it used to be that we would push patients for deep brain stimulation only after we've exhausted every medicine out there, and then if the patient still experiences, side effects or significant motor fluctuations or bad dyskinesias, then we kind of start talking about deep brain stimulation. But nowadays we're kind of pushing that earlier and earlier. And in fact, many of my patients, when they ask about deep brain stimulation, I kind of say, the moment that you have some indication for it, which is motor fluctuation or dyskinesias, or that if you're not tolerating the Parkinson's medicines too well, or if you're getting a little bit too old and therefore you might miss the boat, so to speak, I start talking about deep brain stimulation, with them. And so the things that can preclude you from being a candidate for deep brain stimulation will be if you're too old, and that's a number that's kind of relative. Although in my practice, I would say too old is maybe 80 years old or above. If you're too sick, so in other words, you have a laundry list of medical issues, cancer, cardiovascular disease, and so on and so forth. Or if you're too cognitively impaired, and in fact, one of the things that we do prior to deep brain stimulation is we do a neuropsychology test to make sure that the patient is not too cognitively impaired, it's definitely not demented, moving into deep brain stimulation, because these patients that are demented just don't do very well after DBS, and that their recovery from surgery is really very rocky. And then if patients are intolerant to Parkinson's medicines, they usually earn an earlier ticket to DBS, and some of these patients who don't even tolerate a whiff of levodopa, and that the weaker medicines that they're tried on are just not strong enough to treat their symptoms. So these are the type of patients that I would push for earlier rather than later DBS. Although I would encourage you though to watch, the DBS videos that we have in our website as well as in the MDFA website, so you can learn more about DBS. And we hold classes, DBS classes every 6 to 8 weeks that you can join virtually or in person if you happen to be here in Arizona. Okay, here's a question I've been asked several times in my office recently. I recently saw in TV that coffee can prolong one's life. Is this true? Can I take coffee if I have Parkinson's disease? And how much can I take? So I think this came about because of some recent things that we saw on TV and in the internet and in printed media about coffee being good for your health. This was actually a study that was published in the Annals of Internal Medicine just this May. And this was a study that involved more than 170,000 participants in the UK. They had no baseline cardiovascular disease or cancer, and then they were followed over a period of a median of about 7 years. And then what they found from that study was that individuals that were regular consumers of unsweetened coffee of any amount were 60 to 21% less likely to die during the 7-year follow-up from whatever cause. And then what about those that use sugar? Well, those that use sugar to a maximum or average of about 1 teaspoon per cup of coffee, and we take about 1.5 to 3.5 cups of coffee per day, had a 29 to 31% less chance of dying during the 7-year follow-up. So it looks like coffee seems to be associated, regular consumption of coffee seems to be associated with prolonged life. And then the data was less conclusive for individuals that use artificial sweeteners. Now, what about for Parkinson's patients? What do we know about coffee and Parkinson's? Well, one is, and we've known this for the longest time, and that the risk of Parkinson's is actually reduced by about 5 times among coffee drinkers. So is it the caffeine or is it the coffee beans themselves? So it looks like it is both. Although caffeine is a non-selective adenosine receptor antagonist, and we know for a fact that these receptors are also found in the basal ganglia, which are the same structures, deep structures in your brain that are affected in Parkinson's patients. But also, coffee is very rich in antioxidants, and one particular antioxidant which has been zeroed in coffee, which seems to be helpful for Parkinson's, is chlorogenic acid. And in fact, in rat models of Parkinson's, chlorogenic acid protects against the formation of this so-called misfolded alpha-synuclein, which we've talked about in our past webinars as the pathology that is seen in Parkinson's patients that comprises the so-called Lewy body, and that if you have this misfolded alpha-synuclein, it is a marker for cell death. And so chlorogenic acid seems to be protective against the misfolding of this alpha-synuclein, therefore increases survival of cells. And that there's also been studies that chlorogenic acid improves cognitive function in patients with mild cognitive impairment. But of course, the other question is, given that patients with Parkinson's and tremors, will coffee make their tremors worse? So interestingly, there's this study that came out of BMC Neurology in 2019, and they looked at the effect of coffee consumption and tremors in patients with de novo untreated Parkinson's. So these were over 200 patients, and they were divided into two groups, those that were coffee drinkers and those that were non-coffee drinkers. And the coffee drinkers were mainly younger, they're male, they're more educated, they had more young onset Parkinson's. And what they found was, and this is paradoxical, when it was a surprise to me as well, that number one, the coffee drinkers had lower motor scores in this Parkinson's scale that we use, so their Parkinson's was less severe. And number two, and this was even more surprising, that coffee drinkers had lower tremor scores, especially the rest tremor. And they also had lower scores in bradykinesia, which is slowness, and also better scores in gait and posture. So it looks like coffee, as long as you take it in moderate amounts, maybe 1, maybe 2, maybe 3 cups of coffee per day, may actually be beneficial for even Parkinson's patients that are already symptomatic and may not worsen their tremors, and in fact may improve not only tremors but the other features of Parkinson's as well. Okay, I think we have to wrap up at this point. There's a lot more questions that were submitted, and I think we'll be happy to answer those in the subsequent webinar. So at this point, I'm going to turn over the floor back to Taylor.